Welcome, everyone, and thank you for joining Amethyst at Penn's March seminar. We are proud to offer this content through our Amethyst at Penn Hub, which stands for Achieving Maternal Equity and Transforming Health through Implementation Science and Training. Funding for this hub comes from the NIH's Improve initiative, which aims to reduce maternal mortality and improve pregnancy, perinatal, and postpartum care. All right, well, thank you for joining. My name is Emily Fender. I'm a postdoctoral researcher at Amethyst, and I'm presenting the impact of strategic maternal health messages on social media. I'm a recent PhD graduate from the University of Delaware in May of 2024. My background is in health communication, and specifically, the things that I do are analyze health messages on social media pertaining to women's reproductive health. And then I also experimentally test those messages to understand the impact of social media content on health decisions and health behaviors. So today I want to do a couple of things. I want to provide an importance or an introduction to the importance of science communication on social media. I want to talk about knowing your audience, social media usage patterns in the US by racial and ethnic group. So, understanding how to target specific populations with our messages is really important, and we can do that using social media. I'm going to spend some time talking about defining social media engagement and why engagement is so important for understanding the impact of our messages. And then also, finally, I'm going to talk about two social media women's health studies and discuss the ways in which we can use those as models for disseminating information in a social media space. There is a second part to this series, which will focus on how to create social media posts. It's focused on developing strategic and evidence-based social media content. And so that's something that we'll be exploring in the April seminar. So, just a couple of aims for this seminar series, being that this is part one of two. I'd like to acknowledge that social media is a tool to disseminate evidence-based information. Part of the Policy and Communication Core's goal at Amethyst is to disseminate evidence-based information, and we know that social media is a powerful tool to do this. And so I'd like to highlight throughout this presentation that the role social media plays in amplifying maternal health awareness and addressing health disparities. Additionally, translating evidence is really complex. So I'd like to address the challenge of translating complex maternal health research into concise, engaging social media messages. This will primarily be in the second seminar. And then finally, addressing health misinformation and fear mongering. I'd like to, highlight that part of our role as researchers is to amplify research-driven health information on social media to counter widespread health misinformation about women's health. And so that's something we'll be focusing on as well. And the focus on health misinformation and fear mongering leads me into one of the first things that I want to discuss today, which is we need evidence-based messaging on social media to help mitigate the spread of health misinformation. I've done some content analysis work on social media in the context of contraception, and what we found in this study, which was published in Health Promotion Practice, 57 cited hormonal contraception side effects in just a sample of 100 TikTok videos. Among those side effects, we noted three of the most important ones that kind of emerged from the study. The first one was that the belief that birth control changes who you're attracted to and causes breakups. In a lot of these posts, people were suggesting that the reason why the divorce rate is so high and the reason why we have such high rates of breakups and breakdown of romantic relationships is directly because of birth control use, hormonal birth control use in particular. The second thing that really emerged in one of these 57 cited side effects was the belief that all hormonal birth control is directly causing cancer, regardless of medical history or medical background, without taking into account any of the nuance that goes into a statement like that. And then one of the other things that emerged that was really popular in these videos was that birth control is the cause of the mental health crisis among young people. It is the direct cause of anxiety and depression and bipolar and all sorts of mental health conditions. And so these were some of the examples of misinformation or misguided information that emerged from just 100 TikTok videos in this sample. The other thing that happened was the use of the FDA package insert. We called it the FDA package insert trend, where essentially a creator would post a video where she was holding the FDA insert, the large sheet of paper that contains all the side effects and information that you need to know before taking the medication, and kind of waving around as large enough to use as a blanket for taking a nap. And essentially, these messages and these videos were saying this product is dangerous by virtue of the fact that the paper is very large and the font very small. We saw a lot of very strong causal language, ignoring all of the possible relationships or explanations for why any of these side effects were occurring. And these trends in women's health are alarming because some of my recent experimental work shows that when people perceive these content creators and these influencers as having greater trustworthiness or greater expertise, they are more likely to intend to use the less effective birth control options touted by the creators and influencers, even though those options are less effective. And so these videos have real consequences on women's health behaviors. In addition to misinformation, we also see the issue of fear mongering. Um, when we're talking about fear mongering, it's seeing these really damaging trends, um, specifically in the context of pap smears, is where I've seen it in my content analysis work. We did a content analysis on TikTok. We pulled a sample of 155 TikTok videos and analyzed them. And we pulled them using the hashtag pap smear and first pap smear, those two hashtags. And the study is currently under review. And what we found was that nearly 20% filmed themselves during a pap smear exam to show how painful it is. And I'm not denying that pap smears can be painful. That's absolutely not what I'm saying. What's happening, though, is that we're seeing this spread of fear in regard to women's health. And so when we talk about fear mongering in a social media context, it's the deliberate or exaggerated use of fear-inducing content to influence public perception, behavior, or emotions. So we see this a lot as sensationalized language, misleading statistics, cherry-picked evidence, and emotional manipulation. In some of the content of these pap smears, they would title the vlogs "Girl Horror Vlog," my first pap smear. This is a concerning trend because the expectation of pain can lead to the increased perception of pain. So if people are watching these and starting to fear routine exams like this, it can cause increased pain perception during the actual exam. So definitely a concerning trend that we are seeing moving forward. The next thing I want to talk about is knowing your audience and who is on these platforms and how can we reach them. This is data from the Pew Research Center showing that in 2024, the top social media platforms that researchers should be aware of were YouTube, Facebook, Instagram, and TikTok, Pinterest as well. And one of the most important parts of information dissemination and communication is understanding our audience. And so these are platforms researchers should consider using to disseminate their findings to counter some of this misinformation and fear mongering that we're seeing online. There's also more to be seen here about audience, particularly with gender, right? In maternal health, we're like more likely to be primarily reaching pregnant people with our research findings, so likely more women than men. And Pew suggests that women are consistently more active on platforms such as Facebook, Instagram, and TikTok, making these platforms really key channels for delivering maternal health information. So, for example, 55% of women reported using Instagram in this study versus only 44% of men using it. In addition to gender, we also have race and ethnicity. So, Black, Hispanic, and Asian adults are more likely than white adults to engage with platforms like Instagram, YouTube, and TikTok. This information is really important for maternal health researchers and our communities because our goals are to reach a diverse population and improve health equity. So, for example, in the data here, 50% of Black adults reported using TikTok compared to just 26% of white adults. And this highlights the potential of these platforms to reach communities that face higher maternal mortality and morbidity. It's also been suggested that in combination with increased social media use and lower health literacy, that underrepresented groups may be more susceptible to health information and fear-mongering on social media, further highlighting the need for evidence-based health messaging. Now, I want to share a little bit about engagement with health information online. What we know is that 33% of US adults report using social media to obtain health information. We also know that this number is probably lower than it's probably higher than what people actually report because many people do not want to admit that they get health information on social media because of social desirability. But we know that it's at least 33%. We also know that Black and Hispanic adults show a greater reliance on social media for health content compared to white adults. And so social media has become this primary source of information, health information among underrepresented groups. And additionally, younger demographics are more likely to turn to platforms like Instagram, TikTok, and YouTube for health-related information. Probably no surprise there. And these are really trusted platforms, right? These platforms, they're not just for entertainment, they're trusted spaces for learning about health topics, engaging in conversations, and finding relatable lived experiences. We call these lived experiences in health embodied knowledge. Embodied knowledge really performs well on social media because people are tending to trust those who have lived with a health condition and then share their experience with it. And they really, that content really resonates in these online spaces. And importantly, social media, through this sharing of embodied knowledge and embodied experience, social media is democratizing health information. It's enabling two-way communication, allowing users to interact, to ask questions, to share stories, even interact with medical professionals. And this participatory nature really fosters trust and engagement while also giving marginalized voices a platform to share their experiences. And so, more on trust and credibility here about social media. Traditional health institutions are being viewed as less accessible and unrelatable. And social media really allows for content that feels personable, approachable, and tailored to individual needs, which is what's building trust. So we did a study and we asked college students why they get their health information from social media influencers. And what they said was that they get tailored health advice. So they can find someone who's experiencing the health condition or the health experience that they have and get real lived experience from them rather than talking to a medical professional about it. And so again, we see this democratization of health information. An Instagram post right here on the right from a relatable mother sharing her preeclampsia story can resonate more deeply than a generic infographic from a health organization, right? This post had 105, over 105,000 likes, probably hundreds of thousands of views, reaching a massive audience. And so, while these platforms show the power of social media, it's important to recognize why it's effective and its ability to bypass traditional health information barriers is really critical for reaching underserved populations. And so the challenge for researchers is condensing nuanced maternal health research into concise, engaging, and digestible formats. And to do this, we need to understand translational science to really bridge this gap between research and practice because the type of information created typically by providers and physicians and doctors isn't getting as much engagement as a post like this here on the right from a person who has actually experienced something. And so now that we've established the importance of social media as a tool for disseminating health information among our target audience, I want to talk more about how we evaluate which types of messages perform best on these platforms. So in social media research, engagement, thinking about likes, comments, shares, saves, and views really serve as key indicators for how well a message resonates with its audience. And it's okay, so why focus on engagement? It's not just a measure of popularity, it's also playing a critical role in the visibility of posts with platform algorithms. So social media platforms and algorithms prioritize content that gets higher engagement because it signals that it's relevant to its users. And posts with more engagement are more likely to appear on users' feeds, be recommended to others, and even go viral, meaning that they're reaching exponentially more people than a less engaged post. And so for maternal health topics, this increased visibility is critical to spreading vital information to as many people as possible. Engagement's not one directional or one dimensional. A like might signal passive agreement, while a comment might reflect active participation. And these different forms of engagement give us insight into not just how widely a message spreads, but also how deeply it's resonating with its audiences. And by analyzing these patterns, we can determine the types of messages that are most effective at capturing attention, promoting action, and also inspiring future discussion. With this understanding, I want to explore which types of maternal health messages perform best on social media and why certain formats and content strategies are more likely to succeed. And so some of these examples will be in the context of women's health, because my maternal health work is in progress. But the best method for analyzing social media content and engagement that I've found is quantitative content analysis. And this approach allows us to systematically examine patterns in posts. And so through content analysis, we can quantify the relationship between specific message features like tone, efficacy, call to action, and we can look at that in relation to engagement metrics like views and likes. And so these findings provide actionable insights into what drives audience interaction, and more importantly, what encourages users to act on the information, the health information that's shared with them. And finally, to understand why certain messages work better than others, we use communication theory as a guiding framework when coding and analyzing social media content. So there really is a science and a theoretical explanation behind why certain types of messages perform better in terms of engagement on social media. So I want to share findings from two of my women's health and social media content analysis studies. The first one is on PMDD, premenstrual dysphoric disorder. This was published in Health Communication in 2024. And then a study on preeclampsia, which is currently in progress. The data just came in for this project. So let's talk about PMDD. What we did was we selected the top 100 TikTok videos at one point in time using the hashtag PMDD on the TikTok platform. And the questions that we had were, do videos about PMDD containing disenfranchising talk, DT, and emotionality yield higher engagement in the form of likes, comments, and shares than videos without? The theory of communicative disenfranchisement is a reproductive justice-based framework that highlights how systemic inequities and power imbalances suppress marginalized communities' voices in healthcare communication. This is pretty fitting for a study about PMDD because it's typically called a contested illness, which can amplify systemic inequities. And so disenfranchising talk aims to keep the status quo, and the functions of it are silencing, discrediting, and stereotyping. So to answer that research question, we were coding videos, present or absent, if they had reference to women or people experiencing PMDD feeling silenced, discredited, or stereotyped. We also looked at emotionality. This was a present or absent code, and emotionality was coded present if there was a ton of emotion used in the video. A ton of emotion would look like crying, screaming, yelling, really closed off nonverbals, or a very aggressive tone. What we found was that videos containing disenfranchising talk, so that's silencing, stereotyping, those had significantly more comments than videos without DT, right? 2,100 versus 375. Videos containing disenfranchising talk also had significantly more saves than videos without, meaning that people wanted to save the content and look at it later. Difference of a mean of over 10,000 versus about 3,800. And then finally, videos containing emotionality, so that screaming, crying, really intense emotion, had significantly more comments than videos without, a mean of about 1,800 versus 302. So some implications for this, videos with disenfranchising talk or emotionality likely resonate more with viewers because they reflect more personal and often marginalized experiences. And so what we see is that this is pretty common in the literature. This has been supported by previous research in the mental health space on social media. And so using this personal experience, this deep emotion, talking about being silenced, ignored, garners a lot of engagement online. Emotional storytelling is also a powerful driver for engagement. So, incorporating emotionally resonant content into maternal health messaging, such as narratives about challenges or triumphs during pregnancy, could spark dialogue and increase visibility for maternal health researchers. The other study I want to share with you is about preeclampsia on social media. What we did was we analyzed 211 TikTok and Instagram posts. These were collected over a period of 8 weeks. And we asked which types of messages, threat or efficacy messages, received the highest engagement on social media. We examined threat and efficacy messages or appeals guided by the extended parallel process model, which is a theory we often use to understand fear-based messages. Um, and so, according to the extended parallel process model, when people are exposed to fear-inducing messages, which happens often in the space of preeclampsia messaging on social media, they evaluate two key elements, those being threat and efficacy appraisals. So, for threat, people assess the severity of the threat, how serious it is, and their susceptibility to it. How likely are they to be affected? And if the threat is perceived as low, they typically don't respond to the message and they're unlikely to take action. This is how we see messages and communication impacting health behaviors. With efficacy appraisals, people evaluate their ability to effectively reduce the threat. And this might involve whether the recommended action is whether they think the recommended action in the video or in the communication is effective at mitigating the threat. And then also they evaluate their self-efficacy, whether they feel capable of performing the recommended action. So if a video or a message makes them feel capable and having greater self-efficacy, they're more likely to respond to the health threat. And so that's the framework that guided how we coded these videos. And for threat and efficacy appeals, it was really a yes, no. Is there a threat message? Yes or no. Is there an efficacy message? Yes, no. One of the efficacy codes was to advocate for knowing the signs and symptoms. So a lot of creators would say, make sure you know the signs and symptoms of preeclampsia so that you can take care of yourself and get the help you need. And that's instilling efficacy into the reader, the consumer of that message. So if we saw something like that, we would go yes to efficacy. And then we also asked, do peer or provider messages receive higher engagement on social media? So here are some of our findings. Surprisingly, those who advocated for knowing the signs and symptoms or seeking help when something feels off got significantly less likes, right? 5,300 versus 17 or 5,300 versus 16,000. Seeking or showing, talking about signs and symptoms and interest in seeking help is not performing as well on social media. What we found was that health sources, which included health organizations and physicians or nurses, were significantly more likely to advocate for knowing the signs and symptoms, right? So they were getting less engagement. There were no significant differences for threat-based messaging and engagement. So saying that preeclampsia is severe or that people are susceptible to it did not increase engagement. We also found that content and lay users, so like influencers and just regular creators with fewer followers, receive significantly more likes, 16,000, compared to health sources, right, being about 4,700. So physicians and health organizations were getting far less engagement than other creators. Some implications. Physicians have a tendency to talk about knowing the signs and symptoms. However, audiences may feel that content that may prefer content that feels less prescriptive or directive, possibly because it seems more engaging, relatable, or even emotionally resonant than instructional. Health organizations and providers are significantly more likely to advocate for recognizing symptoms, yet their engagement remains much lower compared to lay users and content creators. This reinforces the idea that institutional messaging may not be resonating as effectively with the public. There were no significant differences in engagement for threat-based messaging, which is severity and susceptibility, suggesting that fear-based appeals may not be as impactful in driving interaction on social media platforms. And then finally, the significant difference in likes between content creators and health sources suggests that audiences trust or relate more to non-expert voices on social media. This poses challenges for public health communication because it indicates that authoritative sources may struggle to gain traction despite their credibility. So some implications. Health organizations may need to rethink their messaging strategies, possibly shifting towards storytelling, personal narratives, or influencer collaborations to boost engagement. Simply providing information is not enough. Engagement is key, and public health campaigns may need to study how content creators effectively capture attention. And finally, interventions could focus on amplifying credible voices that already have an engaged following rather than solely relying on traditional health authorities. So, by integrating theories like the extended parallel process model and disenfranchising talk, we can move beyond intuition and ground message design in evidence. This ensures that we're not only engaging audiences, but also driving the behaviors that can make a tangible impact on maternal health outcomes. Engagement metrics like comments and saves are not just vanity metrics, they reflect content that resonates deeply with the audience and has the potential for increased reach through social media algorithms. Your findings underscore the importance of intentional content design. Social media campaigns should prioritize strategies that combine data-backed techniques like disenfranchising talk, emotionality, or even threat and efficacy-based messages to amplify maternal health messages, drive behavior change, and ultimately spread awareness. Thank you.